My name is Peter Coquinos. I am the director of the Exercise Science Lab and Lifestyle Interventions Program for veterans at the Veterans Affairs Medical Center in Washington, D.C. I'm also a professor at Georgetown and George Washington Universities. The title of the study is Cardiorespiratory Fitness and the Paradoxical BMI-Mortality Association in Male Veterans. It is scheduled for publication in the upcoming issue of Mayo Clinic Proceedings. Recent studies reported a puzzling phenomenon termed the obesity paradox, in which overweight and obese individuals have lower mortality than normal weight. However, these studies did not consider the fitness status of the participants. Since increased fitness is associated with lower mortality risk and at times lower body weight, it is important that fitness is considered when assessing the BMI mortality risk relationship. In the current study, we examined the association between BMI and mortality risk, taking into consideration the fitness status of the individual. Our cohort consisted of over 18,000 male veterans from the Veterans Affairs Medical Center in Washington, D.C. and Palo Alto, California. We stratified the cohort into 3 fitness categories: low, moderate, and high fit, based on the peak MET level achieved during a standardized exercise test. We also identified the BMI level with a hazard ratio of 1. This BMI level was approximately 26 kilograms per meter squared. We then used this BMI level, plus or minus 2 units of BMI, to form the reference group. In addition, we formed the following 4 BMI categories: 18.5 to 20 kilograms per meter squared, 20.1 to 23.9, 28 to 31.9, and 32 or greater kilograms per meter squared. We excluded individuals with an abnormal response to exercise and those with a BMI less than 18.5 kilograms per meter squared. We also adjusted for age, traditional cardiovascular risk factors, medication, and muscle wasting diseases. We found that the paradoxical association of high mortality risk in individuals with low BMI levels was observed only in moderate and low fit individuals and not in high fit. Thus, fitness greatly influences the paradoxical BMI mortality risk association. In addition, at any BMI category, the mortality risk was substantially lower with improved fitness. Previous reports raised the possibility that low BMI may increase mortality risk. This study supports that low BMI associated with increased fitness is not associated with increased mortality. Thus, the paradoxically higher mortality risk observed in lower BMI is likely the result of unhealthy reduction in body weight and, perhaps most importantly, significant loss of lean body mass. Patients should maintain a physically active lifestyle and should also seek professional help for any unexplained weight changes, especially weight loss. First, we need to determine what the ideal BMI is for all patients, different ages, and perhaps different disease categories. First, it is important to determine what the ideal BMI is, and the question is it really a low BMI the cause of increased mortality risk, or a low lean body mass? Our findings indicate that lower BMI levels do not significantly increase the risk for premature death if they are associated with higher fitness. Thus, the paradoxically higher mortality risk observed with lower body weight, as represented by low BMI, is likely the result of unhealthy reduction in body weight and, perhaps most importantly, significant loss of lean body mass. Our findings also strongly suggest that the increased fitness is protective regardless of BMI. And therefore, healthcare providers should advise their patients to improve their fitness status regardless of BMI. They should also caution their patients against efforts to achieve unrealistically low BMI goals.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.